My name is Shawna Dellecave. I'm an art and expressive therapist working in Louisville, Kentucky.
My name is Jennifer Murphy. I work as a clinical counselor in the state of Kentucky, and I'm also a supervisor for that license. And I received my master's degree from U of L in art therapy, so I'm also trained as an art therapist. Art therapy is the use of expressive means in a therapeutic setting to help someone process through whatever they're there for. And it can take many forms and many shapes.
An art therapist will have a background and extensive training in psychotherapeutic modalities and theories. And the art therapist also has additional training to use a wide variety of art media, painting, drawing, sculpture, everything under the sun related to art making can be applied within the art therapy setting.
It can be as simple as using some crayons or colored pencils and some paper. It can be creating large sculpture. It can be using photography, utilizing other three-dimensional techniques. It kind of takes whatever form is needed at the time, depending on the needs of the person and their interests.
How does the art media affect a person's response within a therapeutic setting is essential to art therapy. That is basically the essence of what art therapists learn. The different qualities that a media may have, like paint has a wet, loose, flowing quality. So when a person uses a media like paint that is wet and loose and flowing, it will elicit a certain response from that person. That response can be intentional, or it could be unconscious and possibly unintentional. So all art therapy media have different qualities. Drawing with a ruler is a very structured and supported, it's very analytic. So if a person requires that type of support to be very structured and very maybe cognitive, using their mind to think of plans or think of goals, using pencil and paper and ruler might be just the media they need. Possibly opposite from that, if they need to stop thinking so much and maybe they just need a release, they might enjoy painting more, or possibly clay that doesn't require as much thinking. We can just put our hands in the clay and let our hands start doing the work. It has an immediate kinesthetic effect. Kinesthetic meaning how it feels with your body, and you're experiencing it with your body. So understanding the inherent qualities within art media is the true essence of art therapy. And a trained art therapist knows very well the different media and their qualities, and they use that knowledge to help their clients express, find fruition of their goals, whatever the content of the treatment plan entails.
You do not have to be an artist to go to art therapy or benefit from art therapy at all. I think the biggest thing I ever hear when I tell people, how about we do some art today? Oh, I'm not good at that. I'm like, that doesn't really matter. It's all about you actually participating in the process and not necessarily about how nice it looks at the end. I've used it with young children. I've used it with teenagers. I've used it with middle-aged people, with, people that you would consider in the geriatric age range. Like it is a process that spans age, culture, and experience.
In art therapy, the product, the thing that is made at the end, is not the most important part. The most important part of art therapy is using the art tools, the media, paint, drawing, all of those things, using that process to express yourself. That's the main part. And as long as a person can interact with the art media, no matter what that may be, by listening, looking, feeling, creating with their hands, their body, as long as they can experience the process of creating and witnessing art, then you will have benefit if you are looking for benefit. Because I truly do believe that being creative is an inherent part of being human and having a human experience. And when our creativity is blocked or hindered, I find that's when people run into problems, feeling stagnant in whatever area that might be in their life. So my biased belief is that everyone could benefit from expressing themselves in creative ways. And when you meet with an art therapist, it's that art therapist's job to, again, find the media that meets the client's needs for the goals that the client has. So if the art therapist isn't there to just say, we're only going to do this kind of art, it's a team effort, especially if you're working with a therapist who is a person-centered, using person-centered theories.
We describe it through the expressive therapies continuum, which discusses what level of processing we're really doing. And you can have art therapy that falls into that, that's, you know, traditional, like what people would think Freudian or psychodynamic theory or cognitive behavioral theory, or, you know, I use it with dialectical behavior therapy. I've seen it used with EMDR therapy. So it really spans, it has applications across settings, and the way the therapist applies it is based on their theory that they operate out of.
It can be done individually, where you're just meeting with you and a therapist. It could be done in group settings, where you are with a group of people. Obviously, maybe there's a similar theme or issue that group has a goal related to. But in addition to that, art therapy also has a couple different processes. Art therapy can be done with a focus on using a creation of art to get to a root problem or explore a problem. It can also be used just as process alone, and the end result of the art piece isn't analyzed or discussed as much. It's that kind of therapy is really just about the process of making and the experience of making an art piece. And then there's also a modality called open studio, much like an art student would experience an open studio atmosphere, and an open open studio art therapy experience. It's very similar to an art studio with a wide variety of supplies for art therapy patients to use, and they would come in and they may be somewhat self-directed, but also looking to the art therapist for guidance related to their goals for their projects, or, you know, their personal growth goals. So lots of different ways to do art therapy, but in a traditional sense, it's often very similar to traditional therapy.
Art therapy differs from traditional therapy in a few ways. One is that obviously it uses this expressive means that seems to tap into other areas of the emotions and psyche of the person that traditional talk therapy doesn't necessarily do right away. I think you can get there, but the connection is just so much more seamless with art. Art is something humans have been doing since we began, is that outward expression of an inward state. So that connection is still very strong, and we don't understand everything about it, but we know that it works. And it's so individual and subjective that you've got to really meet every person where they're at and work your way through.
Anywhere mental health services are being provided is an area where an art therapist could work. So that can look like an outpatient therapy building setting. And they're in schools. They are in substance abuse treatment facilities, hospitals. They can be in adult day programs for individuals who need that support during the day. Again, those are the places that are coming to my mind quickly, but any place mental health services are being delivered, that's a place where an art therapist could be.
A lot of people will list themselves on like Psychology Today and things like that. But there is a little bit of a caveat here. So while I say that I'm trained as an art therapist, I am, but I do not have an art therapy license. And so that's a little different. Um, so a lot of people can put on their Psychology Today that they are an art therapist, but that doesn't mean that they went to school for art therapy. So you kind of need to look for the licensure in whatever particular state you're in. In Kentucky, it's the LPAT or the LPATA to show that they have that training and experience. And there's also the ATR and ATRBC that is a national credential for an art therapist. But that doesn't take away from the fact that I was trained as an art therapist. So I just have to say that I'm trained as an art therapist, not that I am a licensed art therapist. That's why I was a little different on how I described my licensure, if that makes sense.
So how do you find one? The best place is typically to start with your insurance, calling your insurance provider, stating that you would like to work with an art therapist. And what a person needs to look for here in the state of Kentucky is to look for a licensed professional art therapist. That person, that stands for LPAT, LPAT, licensed professional art therapist. When you are working with a person who has those credentials, you know that they have received the highest level of authority within the state of Kentucky and the US because of the accreditation that a person has to go through to receive that credential. So when looking for an art therapist in Kentucky, that is what you want to look for, someone who has the credential of a LPAT, licensed professional art therapist. Now, there are also LPATAs, LPATA. That's a person who is in the process of earning their full licensure. And so they are also well credentialed. So a person who wants to work with an art therapist should look for those credentials.
You need a trained art therapist. The reason that we have a formal training program, the reason that we have licensure is because it can be a very powerful tool, and powerful tools can be harmful if you don't know how to use them. I've worked with clinicians that are awesome clinicians in the past, but they're going to be like, I'm going to do this art thing. And they're like, oh my gosh, that went horribly wrong. Everybody just refused to participate and was crying. And I was like, oh, well, because you did this thing and that wasn't the best choice because of this, but they didn't have the background and training to know that, you know? So it's important to find a trained or licensed art therapist if that's what you're looking for, because it's just going to be a lot more helpful for you and a lot more positive experience. People can do art all the time and not have a negative experience. That's not what I'm saying, but in a therapeutic clinical setting, you need someone trained. It's like, you're not going to go to your dentist for physical therapy. Like you go to them for their specialty and their training.
I mostly, when I'm working, especially with adults, want the adults to know that the focus is not on the end product. Very likely, when you focus on the process of creating an art piece and really trust the art therapist to guide you through that process, you are going to have deep connection and feeling with the product that is created at the end, no matter what it looks like. Because as we say, beauty is in the eye of the beholder. And when we truly allow ourselves to have a creative experience, we learn that it doesn't matter so much what the end result looked like. It's so much about the journey. So oftentimes when people are resistant about art therapy, it's because they say, I'm not an artist and I don't have any artistic skill. And I'm just always a cheerleader saying, those things aren't important. As long as you are authentically here and present as best you can be, you will find meaning and value in the work. So that's what I want people to know about art therapy. It's just another way to be a human and express creativity.